Hi, I'm Dr. Craig Warden. I'm the medical director for Clackamas Fire, Estacada Fire, and also the associate medical director for AMR Clackamas. And we're here to do the protocol updates for 2018. And with me is Mike Verkest.
How's it going, guys?
Who's the Clackamas Fire EMS training officer. So we're going to go through the Unity update protocol first. So as everyone knows, we had kind of a rocky start with the Unity Hospital.
Yeah.
Things are getting better, and again, I'll put that in parentheses, relatively well.
Yeah.
Their big issue was staffing, so it wasn't anything we were doing as EMS.
It was more of a capacity issue for them.
So they actually they combined like 3 or 4 different psychiatric units, and surprisingly, they lost a lot of personnel who chose to work elsewhere. So they've had a really shaky start. I think things are getting better. The real update is they're getting more confident on the patients that are showing up there, what EMS is triaging. So they want to get more of these patients directly without going through the other emergency departments. So that'll help offload the other community emergency departments and hopefully get patients to where they belong more quickly. Because the EDs were, like I work at OHSU, and we're pretty much stuffed with psychiatric patients. So any patients we can get directly to Unity would be great. Yeah. But we still have our main issue is we need to make sure they're medically stable before they go to Unity. So things to look for when you have your typical agitated patient is to look for these kind of red flags to make sure they're really appropriate for Unity. So if they have a waxing and waning level of consciousness, that could usually means they have an acute delirium, and that is usually a medical issue and not a psychiatric issue. Yeah. People that are having psychiatric issues are usually, they'll get agitated, but their level of consciousness is going to be the same. So if they're having alternating level of consciousness, they need to go to emergency department for evaluation. If they have abnormal vital signs, and we need to also get a temperature on these patients. So we've loosened up the vital signs criteria, and we'll go through those at the end to make them more liberal so patients can go to Unity. But again, remember, Unity has very limited medical capacity. So if there's any doubt, bring them to emergency department first. Other things, so abnormal vital signs could indicate that they're intoxicated with some drug or alcohol, or they're having a medical emergency. The other thing to check is to make sure their pupils are normal. If they have dilated pupils, again, they could be on sympathomimetic drugs, or they could have had a head injury, so always look for that. If they have pinpoint pupils, they may be on other medications, including narcotic drugs. If a patient is having their first psychotic episode and they're older than 30 years old, that's usually an indication that it's a medical problem and not a primary psychiatric problem. So people that are schizophrenic, bipolar, they usually manifest in their teenage years or their early 20s. So again, a late onset of having problems is usually indicative of either drug abuse or a medical condition. The elderly are really difficult to assess, and we're trying to determine whether this patient is at their baseline, mental status. Are they demented, or are they having an acute delirium? And I would just say with the elderly, even if they have a psychiatric diagnosis, again, look for these other red flags to make sure they're not having a medical emergency. And the other thing to look for is an acute onset of symptoms, like they were fine, the family or friends will say they were fine until a couple days or a couple hours ago, and then they abruptly changed. That could be indicative, again, of drug abuse, or they have a meningitis, encephalitis, some other medical emergency. So again, just look for these red flags before you decide whether to go to Unity or not. Also remember, you can use olanzapine or Zyprexa, the oral dissolving tablet, if the patients are a little bit agitated, but they're not meeting criteria to get the Geodon or Versed. So an oral dose of Zyprexa is okay, and they can still go to Unity. Also remember, there may be on-scene resources for you, like law enforcement or crisis intervention teams. Use their expertise in helping to decide what needs to be done for the patient, where the best place for them to go is. A lot of the crisis intervention teams know their psychiatric patients pretty well and can tell you whether this is their typical psychiatric problem or something different is going on. And always remember, you can call online medical control if you have any concern about whether they should go to Unity or not. And just as a side note, the medical director for MRH now, so if there's ever any concerns with MRH, just feel free to contact me. So here's the updated protocol for 2018. Again, most of it has been changed. The vital signs have gotten a little bit more liberal, so the heart rate has been changed from 60 to 130 is okay. Again, psychiatric patients that are a little bit agitated can have heart rates up to 130, and that's okay. We also made the systolic blood pressure more liberal. Now their blood pressure can be anywhere from 90 to 200. Again, this is all without any other red flag symptoms. Other things that Unity can't take care of patients that have extra pieces to them, like central lines or NG tubes. They don't have the medical backup there like a medical floor at a hospital would have. So they can't do central or peripheral IVs. They can't do G-tube feedings or nasogastric tube feedings. Patients that need dialysis, they can't provide dialysis. If they're pregnant greater than 20 weeks, which is at viability, they're not going to be able to handle somebody who goes into labor and delivers a baby. And then if they have tracheostomies, need oxygen, those are also reasons that they can't go to Unity. So take those patients to the emergency department, we'll sort it out, and sometimes we can get them to Unity with special precautions. And that's it for the Unity update.
Nice. Thanks, Dr. Warden. Appreciate you guys checking it out. We'll see you soon.